Upstate Medical University in Syracuse, New York invites you to be the informed patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amber Smith. One of the most common orthopedic complaints is knee pain. Today, I'll be talking about what to do about knee pain with Jason Cherry. He's a doctor of physical therapy and assistant professor of physical therapy at Upstate. Welcome to the Informed Patient, Dr. Cherry.
Thanks, Amber. It's great to be here. Thanks for inviting me.
Well, let's start by talking about some of the most common causes of knee pain. What's the number one that you see?
Probably the most common knee condition that we see is osteoarthritis of the knee.
And is that something that affects only older people?
No, actually, you do see it more commonly in older people, but you also see it in people as young as 30, 40 years old, depending on factors such as lifestyle, genetics, etc. And then you also see a lot of older people that don't have it. A common misconception is that osteoarthritis is something that is inevitable for old people, and that's just not true.
What does osteoarthritis pain feel like in the knee?
Usually the patient describes a general aching sensation, oftentimes throughout the knee, but sometimes it can be localized to more the inside or the outside of the knee. It's often worse in the morning when the person first gets out of bed and starts walking, and then it tends to feel better as you move because you're circulating fluid throughout the joint. It tends to feel a little bit better, but then if you move too much, then it starts to hurt again.
What about ligament injuries? What do those feel like?
Ligaments are the connective tissue that can connect our bones to each other. And those types of injuries usually require some sort of trauma, either a trauma from somebody hitting you or running into you, or an object hitting you or running into you, or moving in an abnormal way that puts an abnormal stress on the knee. And so usually when that happens, the person will feel a pop or hear a pop, and then usually followed pretty immediately by swelling of the knee.
Do you see ligament injuries mostly in athletes or not necessarily?
Not necessarily. We do tend to see them more commonly in athletes because they're putting themselves in positions that would potentially cause a ligament injury, but everyday activities can also result in a ligament injury. Sometimes just stepping off the curb abnormally, or one of the more common ones is somebody's dog runs into them in their house, sort of sideswipes them. And I've seen ligament injuries happen in those situations too.
Now, the meniscus tear, is that a ligament also?
It's similar to ligament. The meniscus is more like cartilage, and we have two of them in the knee. We have what's called a medial meniscus, which is more towards the inside of the knee, and a lateral meniscus, which is towards the outside of the knee. And they're basically C-shaped structures that help improve the stability and the integrity of the knee. They sort of create more of a ball and socket type of situation, whereas the bones of the knee tend to be pretty flat. And so the meniscus just gives a little bit more integrity to the joint. And so you can tear those. They can develop tears over time from just repetitive trauma, or they can tear from a twisting injury similar to what would cause a ligament injury. The important thing about meniscus tears, though, is that you can have meniscus tears and not have pain because the majority of the meniscus is not innervated by the nervous system. So there's no nerves that would transmit pain signals. So just because somebody has a meniscus tear doesn't mean that they can't function completely normally without pain.
And they won't have the swelling or anything like that either?
Correct. Yeah, especially if it just is something that's happening slowly. An analogy that's often used is it's like wrinkles on the inside. We have little creases that happen in our tissues on the inside, just like we do on our faces.
Now, do you ever see overuse injuries in the knee?
Sure, yeah. Osteoarthritis, which we spoke about before, that can be related to overuse. Also, you have what we call tendinopathy. So ligaments connect bone to bone. Tendons connect muscles to bone. And so if your tendons are not used to the amount of load you're putting on them, especially if you've been relatively inactive and then you suddenly become more active, or sometimes we'll see it in runners who increase their mileage too quickly and the tendon wasn't quite ready for that. And that'll create an irritation of the tendon itself, and that can create pain.
How would a person know that their knee pain needs urgent medical attention or whether they can wait and check in with their doctor the following week? Do you have any sort of guidance to give us on that?
Sure, we can kind of separate into if there's some sort of trauma, that's when we're going to be more apt to recommend somebody seek evaluation by a healthcare provider, especially if that trauma is associated with a loud pop, if the trauma is associated with an inability to put weight on their leg, if there's a lot of swelling that occurs within minutes. Those are all reasons to go to the emergency room or urgent care because those are possible either fractures or significant ligament tears. Other potential cause for a visit to a healthcare provider might be an infection. So things to look out for there is swelling, especially swelling without trauma, increased temperature of the knee, redness of the skin around the knee. Those are all potential signs and symptoms of an infection, and that should be evaluated. And then also vascular conditions, so changes in color of the skin, coolness of the skin down the leg. Any of those things, I would highly recommend going to see a healthcare provider.
This is Upstate's The Informed Patient podcast. I'm your host, Amber Smith. I'm talking about knee pain and management with Jason Cherry, a doctor of physical therapy at Upstate. What sort of treatment can a person do on their own to see if the pain gets better?
If we've ruled out those other things that would require immediate medical attention, we used to use the RICE, so rest, ice, compression, elevation, which those things aren't necessarily bad. We've kind of moved on a little bit from that because we know movement is good. So yes, you want to rest, but you also want to move the joint pretty often throughout the day to help with the circulation to those tissues. Our bodies respond to movement. Our bodies respond to, we call it stress. Stress is often thought of as a bad thing, but we do need a little bit of stress to facilitate that healing process. So gentle movement, it might be slightly painful, but you should recover within a few minutes after doing the movement. So rest, but active rest. If you are experiencing swelling, elevating the extremity is often good as well. So elevating the knee above the heart. You can use compression, but if you do use compression, such as an ACE bandage or a knee sleeve, you should check, make sure you're not experiencing any numbness or tingling or swelling below where you have that bandage to make sure that you're not getting pooling of blood down below the knee. Those are all great things to do to help facilitate the healing process. As a physical therapist, I don't recommend anti-inflammatories or any sort of medications, but I would have a conversation with your healthcare provider about that because we used to tell people to take anti-inflammatories right away after an injury. But what we learned is inflammation, especially right after an injury, is actually good and necessary. That's our body's way of healing. And so inflammation carries the healing products that our tissues need. There are those who say that we should probably avoid anti-inflammatories the first 24 to 72 hours after an injury, but definitely consult with a medical provider regarding any changes in medications that you might make.
What role does physical therapy have in helping people with knee pain?
Our main goal as physical therapists is restoring function. So the first thing we usually do with a patient is identify what their normal function is and what it is they want to be able to do that they're not able to do. And then we would evaluate the patient to see what is getting in the way of that normal function. So at the knee, it can be a problem at the knee, but it can also be things above and below the knee because the knee is reliant on the hip and the foot and ankle for optimal function. So we would look to see, is there a range of motion problem at any of those three joints, the ankle, the knee, or the hip, that's limiting the patient's ability to perform the activities they want. If there is, we do techniques such as we use our hands to help facilitate the mobility of the joint. We prescribe stretches and self-mobilizations to restore mobility of those joints. Or we might find that it's more of a muscular issue where the patient needs to strengthen specific muscles that are not performing the way they should in order to perform that functional activity. And so in that case, we prescribe specific strengthening exercises. And I think the third category we would talk about is movement patterns. So the way that the patient's moving might not be optimal for the activity that they're trying to engage in. And so we would coach that patient in potentially adapting the way that they're moving to be more efficient and better able to perform the activity without putting excessive stress on their knee joint.
Let me ask you about ways to reduce the risk of a knee injury to start with. Are there particular sports or occupations that are bad on the knees?
I wouldn't say there's any sports or occupations that are necessarily bad, but there are sports occupations that put certain types of load on the knees that we should be aware of. So if we talk about occupations where you're down on your knees, so construction workers that are tiling or having to put a lot of pressure on their knees, they may be more susceptible to certain injuries of the knee. And so they could do things like wearing knee pads or making sure they're not in any one position too long on their knees. Or another example is cleaning floors. Being down on your knees cleaning floors can put a lot of stress on your knees. The way I look at this is our tissues have capacity, right? And there's a saying that the capacity of our tissues is only ever slightly greater than the stress we put on our tissues. And so really the best way to prevent injuries is to make sure that our capacity is as high as we can get it. And the way to do that is through regular exercise, proper nutrition, weightlifting, and preparing for the activities that we want to engage in.
What about regular running? Is that good for the knees to keep them in shape and active and moving, or is it bad for the knees?
As far as osteoarthritis, for a long time it was thought that running was bad and it would accelerate osteoarthritis. But what we've actually found, multiple studies have shown that recreational runners, it's the cartilage that we're concerned about. And actually recreational runners have thicker cartilage in their knees than those who don't run. So we can't say that anymore. And we might actually say that running is good for your cartilage. But just like any other activity, in moderation, and the most important thing is progression. So making sure that we're progressing our activity appropriately. So we're not going from not running at all to suddenly running 5 miles every day. That's going to put excessive stress on your knees. But if you are interested in running, it can be perfectly healthy for your knees and actually might be beneficial as long as you progress into the running appropriately.
Well, Dr. Cherry, this has been very interesting and informative, and I thank you for making time to tell us about knee health.
My pleasure. Thanks for having me.
My guest has been Doctor of Physical Therapy Jason Cherry. He's an assistant professor of physical therapy at Upstate. The Informed Patient is a podcast covering health, science, and medicine, brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe, with sound engineering by Bill Brokel and graphic design by Dan Cameron. Find our archive of previous episodes at upstate.edu/informed. If you enjoyed this episode, please invite a friend to listen. You can also rate and review the Informed Patient podcast on Apple Podcasts, YouTube, Spotify, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.